Kannada television actress Chethana Raj passed away at the age of 21. The actor died hours after undergoing a plastic surgery. Chethana's parents have lodged a complaint alleging medical negligence. The actor had also complained of uneasiness after her surgery, post which she was rushed to the hospital, but later was declared brought dead. Chethana's parents have lodged a police complaint and further investigation is underway. In fact, the hospital where the surgery took place has been shut down now as police inquiry is underway. Neha joins me live on the broadcast. Neha, you've been closely tracking this case. What could have possibly gone wrong? Of course, we do know the investigation is underway, but for the benefit of our viewers, give us a sense of what this plastic surgery was that the actor underwent and what is the family alleging?
Well, of course, at this point in time, what the information that we have is that this particular actor over here in concern, Chethana Raj, had gone in for, a fat reduction surgery of sorts. And that is when, a few hours after the surgery, while the surgery was done in the morning, in the evening, she started developing some complications. Of course, one of the sources we spoke to said that she started to develop water in her lungs, following which this issue has cropped up while she was actually rushed to the Kannada hospital over here in Bengaluru after the complications began. The Shetty's hospital where the cosmetic surgery was actually done, the Shetty's cosmetic center over here, in fact, has now been shut down. What you're actually seeing right now are visuals of this very cosmetic clinic where this actor had gone in for her fat reduction surgery. Now, after the surgery was completed, like we mentioned earlier, there were some complications. She developed uneasiness. Later, she was rushed to another hospital, a private hospital, Kannada hospital, wherein, on the insistence of Chethana's doctor, the ICU was, in fact, she was rushed to the ICU where CPR was attempted on her. She was tried to, there was an attempt to revive her for almost about 45 minutes after administering the CPR. But since she did not respond, the hospital too had to declare her brought dead. At the time that she was brought into the hospital, in fact, she had no pulse, is what that hospital says. But it's important over here, again, to mention that at this point in time, while the hospital, has, of course, temporarily been shut down, now pending an inquiry, the actor's family has alleged medical negligence. Now, when we were speaking to a couple of actors prior to this, they said that possibly anything could have happened in this case. The fact that maybe, she was unable to even possibly, take the anesthesia that was administered to her, that is something that could have happened. But that apart, there could have been any other reason also that, something, of course, on the medical front may have gone wrong with her surgery, and which is why this may have happened. So, of course, we'll have to wait until such time that the post-mortem was completed. Also, a little while earlier, we are waiting for the post-mortem report. But a distraught family over here, just going on to sort of narrate their ordeal and say that, it's really quite unfortunate that while her mother was aware of the surgery, her father was taken completely by surprise and shocked, to say the least, and he's gone ahead and registered a complaint. The police have taken a complaint right now of an unnatural death, and we're waiting for more details about the post-mortem at this point.
Right. Neha, also for the benefit of our viewers, could you give us, a sense of talk about the background of Chethana, where she comes from, the kind of work she has done, because the industry has lost a young, talented actor. She was as young as 21 and she lost her life. So to our viewers, especially outside Karnataka, who perhaps do not know Chethana, the work she's done in the past and the kind of background and her struggle to which now she's reached this position.
Well, Chethana, of course, was someone who was very bubbly, is what we do understand, and her social media accounts would go on to speak for that. But, that apart, of course, she had been quite a popular Kannada serial actress, is what we do know. And also, importantly, at this point in time, that she was budding talent. This is what every actor, every senior actor, or, in fact, person in the industry whom we spoke to has gone on to say that, while she has, of course, appeared in several Kannada serials, she's done a few roles in a few Kannada movies as well. So, really, of course, quite shocking over here, coming at a point when, the Dr. Shetty's clinic is supposed to be branded as one of the best cosmetic surgery clinics in the city of Bengaluru. And, of course, to expect something like this coming out from, one of the clinics, which is supposed to be branded as one of the best today, it's really quite shocking. And, this would, of course, probably now, maybe make several people reconsider. We'll also, of course, have to wait and see as to whether a consent form was given, whether the actor was made aware of all of the post complications that could have happened along with the surgery, whether any of that, of course, all of those details are what's being probed by the police right now. But it is, of course, at the end of the day, quite sad that we're having to lose an actor at such a young age, someone who was, still just at the starting of her career.
That's right, Neha. In fact, also let me go across to Thoya Jakshi, who's joining me right now live from Chethana's residence. Thoya Jakshi, what is the sense you're picking up from the ground? Is there any word in from the family in terms of when the last rites will be held? And have her colleagues been visiting her residence since morning to pay their respects, last respects?
Well, right now we're at the residence, whereas they've already taken the body to the burial ground to do the last rites of the Chethana. So we're heading there to the burial ground. So we'll be getting more updates on this once we reach that place.
Right, Thoya Jakshi and Neha, stay with us because also I'm joined by Anil Dhal, who is a cardiologist. Doctor, thank you so much for speaking to Mirror Now on this very critical issue that we're discussing this evening. According to you, what could have possibly gone wrong with the cosmetic surgery? Because we know it is very popular, especially among celebrities in the entertainment industry. What could have possibly gone wrong? What are the risks and dangers that one is signing up to when they're actually undergoing the surgery?
So to be honest, I really don't know what could have gone wrong, what has gone wrong, because that needs a case-by-case evaluation. And but you must remember that any surgery can have complications, and those complications usually there is a informed consent which is taken by the practitioner. And I'm pretty sure that in the case of a celebrity, everything had been discussed with the patient even beforehand. But what I actually, when somebody spoke to me and I thought that, yes, we should add our 2 bit to this very unfortunate piece of information and news, is that one should not get carried away by the tragedy which is unfolded here. This is unfortunately any interventional procedure or surgery can have complications. Many complications are known. Sometimes abnormal metabolisms in individuals could have even higher complications. Suppose somebody's been on certain drugs or something, the complications can be even higher. But what I want to really highlight is that for a lot of people who presume that looks are synonymous with health, it is not true. Beauty actually lies much deeper within. And just as it is very dangerous for society to indulge in fat shaming, must remember that it's not only surgical procedures, but even, for example, excessive exercise can be dangerous. And we have always recommended a middle path. And also, many gym instructors tend to motivate those who attend their gyms. They compel them, the gym goers, to have who are desirous of attractive bodies, to take supplements and certain drugs, which can be very, very dangerous and almost lethal in some cases. So we do not know what is the background to this unfortunate tragedy having happened, but we would like to sensitize all the viewers and listeners that one has to be very careful and judicious about all of this. Avoid excessive exercise. Take the middle path. It should be done gradually under medical supervision, and also to avoid supplements, and especially when people start taking drugs like steroids or anabolic steroids, or in cutting cycle people use clenbuterol for weight loss to get desired bodies. It is not appropriate, and believe me, it is better to be healthy rather than and a little fat may not really go against you
Right.
in terms of longevity and health.
Important advice coming in from Dr. Dhal. There certainly it's very important for our viewers. They could take note of this. Also, doctor, it's imperative for people going in for plastic surgery to make an informed decision when it comes to certain procedures. What should a person look at in terms of clinical procedure or the medical framework, if at all they are considering going under the knife?
Ma'am, I would say that any surgery, and by the way, it is a legal stipulated requirement. All of us practice that even for the smallest bit of intervention, we have to take informed consent. We discuss with the patient and the caregiver. Now, of course, in your case, what you were telling, the father did not know. I can just say that there is normally a next of kin that you discuss with, and there is the patient himself. An adult patient, completely in control of his or her senses, would be in a position to give consent for a procedure. So I think the appropriate would have been done by our medical fraternity, and I'm sure that is not at fault. This is very unfortunate that this has happened, but the pre-morbid condition of the patient, for suppose it's just a liposuction procedure, for you it's just a plastic procedure, but this patient may have tried to adopt certain strange fat diets, or taken a lot of supplements, or taken a lot of different drugs to try and achieve this, even without going under the surgical knife. And that patient could have a host of medical conditions which could work adversely against her. So this entire concept of fat shaming, I think we should try to get more comfortable in our own skin. Yes, work towards fitness, work towards good health, but use standard techniques and not get carried away by either doing extreme diets or extreme fat diets or extreme exercises. They are not good for us.
That's right. A very important point being made by Dr. Anil Dhal. They're talking about body positivity, which, when you talk about the entertainment industry, is the lowest. Of course, you have several celebrities of late who've come out to talk about body positivity, who are sort of against plastic surgeries. But if at all you are going in for one, the doctor's advice is to look at all the medical framework, look at all the guidelines that are being followed. And at the end of the day, what Dr. Anil Dhal is saying is that to believe in yourself, believe in the body you have, and to not pay attention to fat shaming, and of course to get rid of the taboo that's sort of in society where people do fat shame or name call or name tag people. That stereotype and that practice needs to be done away with. Only then perhaps we can develop as a society. Thank you so much, Dr. Dhal, for joining us this evening with your perspective.